Hello, and thank you for joining us on this OncLive peer exchange titled Precision Medicine, a New Frontier in Advanced Cholangiocarcinoma. Despite aggressive therapeutic interventions, the prognosis for cholangiocarcinoma remained poor, with the high recurrence rate even in the majority of the patients who are eligible for surgery. However, better understanding of the mutational landscape of cholangiocarcinoma has led to the emerging landscape surrounding the use of novel therapeutic agents. In this OncLive peer exchange discussion, our colleagues and I, we're going to be discussing the current treatment options and strategies for cholangiocarcinoma. I'm Ghassan Abou-Alfa, attending physician at Memorial Sloan Kettering Cancer Center, professor of medicine at Weill Medical College at Cornell University, and chair of the National Cancer Institute NCI Hepatobiliary Task Force. Participating today are our distinguished panel, Dr. Andrea Wang Gillum, Director of the GI Oncology Program, Division of Oncology at Washington University in St. Louis, Missouri, Dr. Martin Gutierrez, Medical Oncologist and Director of the Phase 1 Program, Co-Chief of Oncology and Gastrointestinal Oncology at Hackensack University Medical Center in Hackensack, New Jersey. Dr. Teresa Macaria, Principal Investigator of the Gastrointestinal and Endocrine Tumors Group at Vall d'Hebron Institute in Oncology in Barcelona, Spain. And Dr. Andrew Zhu, Professor of Medicine at Harvard University Medical School, Massachusetts General Hospital in Boston, Massachusetts. Thank you so much for joining us. Let's begin. We're here to talk about cholangiocarcinoma today, and I have to admit that ourselves and many of our colleagues are not necessarily have the familiarity with the disease per se. And I'll start with you, Andrew. So if I'm not mistaken, cholangiocarcinoma was the old kind of unknown primary?
So, Ghassan, as you know, we definitely have the entity of the so-called unknown primary. But on the other hand, I think as we're doing better with our diagnostic tools, we realize at least a portion of those are actually not classified as true unknown primary. And actually we have very, very sophisticated molecular tools really pinning down that this may actually truly represent the intrahepatic cholangiocarcinoma entity. And so the way to do that, obviously, we have quite a lot of molecular technology to do this. For example, our center developed a very interesting, sophisticated in situ hybridization technique, looking at the expression of the albumin ISH-based assay. So basically, we can tell if you have that gene expression, you actually have a very good confidence the adenocarcinoma is coming from the intrahepatic origin. And so we can actually make the diagnosis for cholangiocarcinoma.
Fair enough. But again, to go back to the basics, and definitely it's nice to see this kind of very advanced work in that regard. But Teresa, in the community, like a cholangiocarcinoma is an adenocarcinoma. How would a pathologist, from your perspective, can really define this is cholangiocarcinoma? What are the basic needs for a pathologist there?
Yeah, I think, of course, the first thing is that we need a core biopsy. So you need a good pathology tissue in order to can do some immunohistochemical test in order to define this is not another kind of tumor, this is not metastasis, this is an intrahepatic cholangiocarcinoma. And I think we have to change our mentality. We need always this core biopsy in order to have enough tissue to do it. I agree that also the molecular characterization of this tissue can help us to say, yeah, this is characteristic of intrahepatic cholangiocarcinoma, but it is true that this is only possible to do it in a high specific units or high volume centers, and in the community, in the rest of hospitals in my country, it's not possible to do it. So you have to have this good tissue and good pathologies. Also the specialized pathology, because if you have a pathology that are looking for the breast cancer, also the intrahepatic, it's more difficult to define it.
Fair enough.